Hi, I'm Dr. Sudha, leading health and travel for Digit General Insurance Company. Today, let's discuss about some common questions you may have about coronavirus. Yeah, so washing hands is the primary thing we should do, and we are being all taught in our school days that maintaining hygiene is so important. It starts with the hand wash because we touch a lot of stuff while working, while going, or handling some of the stuff, and we also eat. We put our hands into our eyes, nose, wherever possible. So it is very, very important to maintain hygiene. If you think that your clothes are being a bit dirty, or you have been traveled in a crowded bus or a metro kind of a stuff, please do change the clothes and also maintain the regular hygiene. Entire body hygiene is very important, but yes, hand hygiene is very, very important here. Yeah, it's very true that the fatality rate is low compared to the other diseases which is caused by the same coronavirus family, something like your SARS and MERS. But it is, I think, the information is also been spread. WHO is also has, the World Health Organization also has declared a pandemic. So there's so much of information which has been floating around in social media, print media, and your other media sources, your WhatsApp, your Facebook, be it anything. And of course, it is a alarming thing, but I think it is also becoming an infodemic, which is not very good to have. Yes, of course, we all need to be having some precautions, follow some basic rules, and keep ourselves away from the crowded places where there could be a possibility of infected persons also be traveling in the same bus or a same in a journey. It's the same journey. We can also avoid some of the going to a concerts kind of a thing, or so wherever there is a crowd possible, and someone who is already sick. So let us stay away from the person, and person is also been kept isolated in a place where a good rest and the supportive medication is been given. So more than causing a fatality, I think it is more of an inconvenience which is bothering us of all. So imagine if I am traveling in a plane where couple of people were infected, they were not even aware of. The entire crew and the passengers who were traveling in the same aircraft are being put in a quarantine. I'm absolutely fine, but just that I'm being part of the journey. I'm a co-passenger of that infected person. I'm being kept in a quarantine, which causes so much of inconvenience. I'm lost, I have so much of work to do, I have some plans to execute, but I'm being kept somewhere for 14 days. So that is also a main concern. So please do take care of yourself. So you don't need to really be panicked about the death. Death is very, very less. If you see, February and March months are the months where you have a lot of seasonal change, and a lot of people have allergy towards, so there is a leaf fall happens, pollen grains, or the seasonal changes also affect, and a lot of people catch cold. Okay, so you should not really think every cold will become a coronavirus. Okay, but if the symptoms are persistent and it is progressive, I mean, it is increasing trend and it is not decreasing with any of the medication which you are using, then please do consult a doctor. Be precautious, but don't get into a panic mode where you get all the tests done, get hospitalized. You don't need to really do that. But if you are experiencing some of the symptoms, please stay away from the crowds, or if you are going to an office, you please inform your employer saying that I'm having some symptoms, let me work from home or take rest for some time. Then it is better to not to spread, even if it is a common cold. It is not advisable to spread it to somebody else, right? So we can stay interiors. It is not true because this virus doesn't really can sustain in a higher temperatures, and when you look at the Indian, especially I'm talking about the Indian context, So the kind of curries we make, we'll do a lot of cooking. We kind of overcook a lot of stuff. So there is a very less chance of having the virus in that cooked food. So you don't need to really worry about, but yes, but you should really look at where you are buying, not because of this virus, but otherwise for your general health. You should really look at, so from where it is coming from. Yeah, it's very important. Face mask may not really help. I just saw in a video someone was selling a face mask on the road, saying that corona ka le lo. So I don't know whether he's selling corona or face mask. So face mask may not really help you, and in fact that is more dangerous if you if you are infected and you are wearing a face mask and then you don't know how to dispose it. It causes more harm and it spreads to more people. And when you don't have the disposal mechanism right in your own area, that in fact spreads more infection to other people because of your own carelessness. So it will not really save you, but yes, it can save you if you have symptoms and you want to sneeze and your hand key is not available around and then you are like trying to sneeze. At least you want to cover up your own sneeze or your cough. That can help. So somebody who has symptoms can always wear it, but not everyone. Everyone wearing it, it's not very helpful. So this is any other respiratory infection. So for a younger generation, even for the kids, it is not very fatal. But elderly people, especially elderly people who has been diagnosed as having coronavirus positive, they have to be a little extra cautious because their immunity is already compromised, and underlying diseases like your cardiovascular disease, somebody who is having diabetes or your heart related problems and already on some certain medications, probably they have to take a special care about themselves. Yeah, so you don't need to really panic. Of course, it is the time to take care as well as follow some basic instructions and keep yourself safe. Doesn't mean that you need to really go panic and you don't need to really worry about stop all your plans, but be safe, follow certain instructions and be yourself.